Okay, this is Matrix Mike, and I want to welcome you to just a very brief case study that I want to talk to you about with regards to matrix repatterning. Just after COVID, I received a request from a former client who had help with knee issues with matrix repatterning. If it is possible to help somebody that was severe back pain, severe hip pain. Um, and I said, it's possible. I said, I can't guarantee. The best thing to do is for that person to come in and let me do an evaluation. So I did. I ended up booking this individual. This individual was believe was just around the age of 70. And unfortunately, during COVID, this person lost their spouse. And as a result of that, ended up gaining a significant amount of weight. So it was very difficult for this individual to move around, so to speak. They had tried other types of therapies and only was able to get them so far. So I basically said to them, let's see what we can do. Now, one of the things with matrix repatterning is that we want our clients to be able to lie down on their back with their knees bent, so that we can put them through a scan from head to toe. So what was really interesting about this individual is because of the weight that this person had, they had a lot of difficulty breathing. So I had to be flexible and change what I was doing for this individual. So I ended up having this person sit on the table and did the scan the best that I could at that time. Now, as it happened, I was able to do a little bit of a scan and I was able to do some treatment that day, which was great. 4 weeks later, we had a little bit of improvement. And I'm back in my mind, I'm thinking, I'm not sure if I can handle, if I can help this person. And because, nature, you want to help somebody and I want to make sure they're coming and they're getting results. So we did a few things a little bit differently, still had the person sitting for the treatment. And then they came back 2 weeks later and the individual is walking without their cane. And uh, that just blew me away. Like I was taken back and I said, where's the cane? I don't need the cane for the short walks anymore. Well, tell me more. So this individual had gone out for um, dinner with their son, and the son was so overwhelmingly happy that the individual was able to walk to them without using the cane. And it was at that moment that I knew there was definitely something to Matrix. There was definitely something to Matrix, even though I've been doing it all these years, even though I've had some, fairly good results. There was definitely something to Matrix and what it can do if you are flexible in the way that you treat. I then saw that person 2 weeks later, and then we decided that we would look at doing a monthly maintenance only if that's what they wanted. And so I saw them maybe two or three more times after that, and then nothing for a while. And of course, as life goes on, you do things. And what's happened now is I do see this person maybe two or three times every year because they do something that, you know, recreates the soreness and the pain. And I think the message is that I want to get out to you that's listening is that there are so many different types of treatments out there, and they're all wonderful. And, many of them I've done, many of them I do believe in. The one thing that I truly find have discovered with matrix repatterning that separates it from everything else is it gives that person, and it actually gives me as a practitioner, a specific base to work from. In other words, uh, you're recreating or you are taking care of the foundational issues. You're getting to the root cause. And when you get to the root cause and you can expand on help solidifying that root cause, to solidifying the foundation, it allows you to build on that. So many times when I treat, I love doing matrix repatterning because it gives me a foundation to build from. And matrix repatterning works from toe to head and head to toe. Remember, we are connected from head to toe. And that's why I love it when I work with concussions. Not that I like people getting hurt, of course not. But one of the amazing things, many times, that just working and clearing out the lower limb, the shins, the legs, so to speak, there can be a decrease in symptoms. There can be increase of range of motion at the neck. And that's because everything is connected. Matrix repatterning on a personal use has made a significant difference for me and my left knee. I right now am carrying two torn meniscus in my left knee, and my left knee has previously been surgically operated on. And one of the things that's really fascinating about Matrix is the last symposium that I went to in 2023. My knee was probably the worst it's been in a long time after doing an 18-kilometer or 16-kilometer walk or 14-kilometer walk camping. And after just one session, it almost felt like brand new. It's just one of those things. Anyways, I just wanted to give you a bit of an update or give you an idea of case history. It's different for everyone, and everyone's success rate is different. The key thing I want you all to remember is it works at the core, it works at a foundational level. And that is why I love matrix repatterning. I am always amazed and will always continue to be amazed as how it can help people when they've gone to other, really good other types of therapies, how it's changed them and changed their life for the better. I'm Michael Wolfgrafstein, otherwise known as Matrix Mike, and I want to thank you for taking the time to listen to this update. If you are curious or interested and you're in the York region area, you can go to my website, mikegrafstein.com, or send me a DM here at Athletic and Massage Therapy Plus. Bye for now, and I hope you have a wonderful rest of your day. Bye.